So we are coming to now the first of our Keynote conference speakers, who is going to lead us in really, I guess, the theme of this entire conference, which is very much focused on disability and equity, and that's what we're going to be talking about for the next few days. Last night, Graham Innes, apart from giving us the best story ever about drinking in New York City, for those of you who missed it, you missed such a treat. And I'm very keen, Graham, to hear the delivery of The Man from Ironbark at any time, drunk or not, your version of it. But he also spoke in glowing terms about our opening keynote speaker today. In fact, he called her the best advocate and leader in the world in the disability space. And I would suggest that he also was talking about Charlotte as a leader in her own right in all spaces around equity or any issue, because this is a person who has done an enormous amount of work in disability and beyond. Charlotte McClain-Nhlapo, did I do that right? Really short tutorial from Charlotte on the pronunciation of Nhlapo. And Charlotte is the Global Disability Advisor in the Social, Urban, Rural and Resilience Global Practice of the World Bank Group, which is working to mainstream disability and development under its twin goals to end poverty and promote shared prosperity. As a disability advisor, Charlotte is working with and supporting operational teams across the institution to ensure the World Bank's policies, programs and projects take people with disabilities into consideration. She is a human rights lawyer in disability and child rights. Previously, she led the USAID's work on disability inclusive development. Prior to this, she worked as a senior operations officer at the World Bank to integrate disability development operations in East Asia Pacific and the Africa regions. But wait, there's more. Earlier in Charlotte's career, she was appointed by President Nelson Mandela as Commissioner to the South African Human Rights Commission, focusing on social and economic rights, disability rights, and child rights. We couldn't be more pleased and actually thrilled and privileged, Charlotte, that you've managed to fit us in Melbourne, in Australia, into your ridiculous schedule, which takes you all over the world, and to choose us and this conference is just, as I said, such a great privilege for us to have you here. A person of your expertise and knowledge and stature in the world and in disability services. So Charlotte's presentation for today is Disability Rights, a Trigger for Social Equity, and I would like you to please join me in welcoming and thanking Charlotte for coming here and for speaking as the opening keynote of the Social Equity Conference today. Thank you, Charlotte.
Good morning, everybody. That was just an amazing, amazing piece of art, theatre, culture, and I'm still trying to kind of absorb all of that, so feeling a bit fragile at the moment. So I'd like to thank very much the organizers for inviting me. And for tolerating with my inability to respond immediately to emails due to very, very long travel schedules. So it's really great to be able to be here. What I thought I'd do this morning is to talk about how the Convention on the Rights of Persons with Disabilities has become, in my view, a transformative tool for social inclusion. And just preface that by saying that for the last 20 years, I've worked on human rights and disability inclusive development. And during this time, I've experienced somewhat of a personal evolution, one that has taken me from a singular focus on rights as the pathway to inclusion, to a more complex, multidisciplinary, multi-layered, and nuanced highway that has many entry points and exits. The World Bank estimates that there are about 1 billion people with disabilities in the world. Differently put, 15% of the world's population. Differently put, 1 out of 7. And even more differently put, it would be about the entire population of India. The Convention on the Rights of Persons with Disabilities, which I will refer to as the CRPD, is undoubtedly the most important global legal framework for disability rights and inclusion. The CRPD has been described by detractors as being too aspirational, as being completely unnecessary, as being an infringement on national sovereignty, or as being yet another useless treaty. I beg to differ, because where I sit, I see facts presented very differently, and I see a very different story. I see the CRPD as being comprehensive in its reach, as being radical in its vision for disability rights and inclusion. And I definitely see it as changing the narrative for persons with disabilities. I think perhaps most importantly, what it's done is it has recognized us, people with disabilities, as full and equal members of the human rights society. So for me, that's an important piece. The CRPD has now been ratified by over 170 countries. And notably, it was negotiated at the UN in the most inclusive manner ever, with very strong participation of persons with disabilities, some of whom are in the room today. So why are rights so important in this changing narrative? Well, let me give you some personal insights. In my current position, I'm working on a right to education project in India. The project exists because there is a right to education. Through its inclusive education component, this project will reach close to 1 million children with disabilities and ensure that these children are included in regular schools. At a training session during the summer last year, I spoke to some of the practitioners, many of whom were quite familiar with the Convention on the Rights of Persons with Disabilities. And that, for me, was about change. In Burundi, I worked on a World Bank project to support the reintegration of disabled ex-combatants. And we built 151 fully accessible homes for disabled ex-combatants. That would not have happened if we had not had the CRPD. I also just want to mention that the CRPD will celebrate this year its 10th anniversary. And that is important because it's only been in force for 10 years. But let me share with you a bit more of my perspective on how the CRPD has become a prized tool for transformative change. Change that bolsters social equity, that promotes human rights, and reduces poverty. So let me start with this one. As a result of the CRPD, we see disability-specific legislation in over 50 countries throughout the world, many varying in quality and scope, and not always true to the spirit and intent of the CRPD. The challenge here is to ensure better knowledge of and the enforcement of the laws that are being developed. As a result of the CRPD, we see an exciting body of jurisprudence developed on the rights contained in the CRPD. And I'll share with you two, I think, interesting and exciting cases that have addressed the various rights in the CRPD. The one is one from South Africa. In 2001, the disability associations representing children with disabilities with severe and profound intellectual disabilities in the Western Cape brought a case against the National and Provincial Department of Basic Education for failing to accommodate these children in public schools. The court directed the South African government to ensure that every child with a severe or profound intellectual and mental disability in that particular area, in that province, has affordable access to basic education of adequate quality. Another transformative case was called in Peru, when a decision to restore voting rights to thousands of persons with disability in an important step towards ensuring their full participation in society. More than 23,000 people with mental and intellectual disabilities had been arbitrarily excluded from the voter registry for 2011, and therefore were not able to participate in presidential elections that year. The National Registry for Identification and Civil Status issued a resolution in October 2011 to nullify this policy and to ensure that people with disabilities were, in fact, on the electoral rolls. I think for me, those are two very significant cases. This is just an example of some of the cases that have come out as a result of the CRPD. Another result of the CRPD that I see is the emergence of national structures. Let's call it a disability architecture that's being erected to respond to the requirements of Article 33 of the Convention on the Rights of Persons with Disabilities. And I think it is therefore important for us to ensure that we strengthen these institutions and build capacity within these institutions, because they certainly play a crucial role in the domestication of the CRPD and can play an important role in transformative change. As a result of the CRPD, we see a groundswell of political participation of persons with disabilities. We see people with disabilities assuming high-level positions in government, in parliaments, and in the case of Ecuador, as vice president of the country. Again, I think this really comes from some of the rights contained in the CRPD around political and participation. As a result of the CRPD, we see disabled people's organizations wrestling with newfound power and purpose and searching for their roles and identities. Should they lobby? Should they advocate? Should they provide services? So we have a whole new cohort of civil society organizations that are thinking about what their role is in relation to promoting human rights and addressing social inclusion. As a result of the CRPD, we see international development donors putting out strategies for disability inclusion, which is certainly a wonderful thing to do, but in many cases, I think they miss an opportunity to go from retail inclusion to wholesale disability inclusion. So, I often wonder, when we look at these strategies, why we're not addressing disability inclusion throughout all of the human rights support, throughout all of the governance support, throughout all of the gender equality support. And so really, how do we start thinking about, within these international agencies, really mainstreaming disability into all of the aspects of their work? As a result of the CRPD, we see many more young people with disabilities from developing countries afforded the opportunity to study abroad and obtain college degrees. ADRA, certainly one contributing factor to that. The US Young African Leaders Initiative, a presidential project, have both directly benefited students with disabilities. This is a significant step, but let me hasten and say that this is by far not enough. We need to move from this being the exception to the norm. As a result of the CRPD, we see global diplomacy erupting with reference to disability inclusion. The Busan High-Level Meeting on Development addresses disability. The Sendai Declaration for Inclusive Disaster Risk Reduction speaks to disability. The UNHCR has put out policies and notes on addressing disability. And perhaps most importantly is the inclusion of disability in the Sustainable Development Goals. And if I may, a quick word on the Sustainable Development Goals, because they do provide a new and ambitious plan for disability that has been set by the international community. So these goals essentially define a set of universal goals which all countries will be expected to implement as a contribution to progressive change, both for their own populations and to meet shared global challenges. It's really the first time that we have a set of global development goals that have explicitly included disability and have addressed disability within and around the notion of leaving no one behind. I think there are going to be some challenges in this regard because it's going to be important to ensure that the universal goals are meaningful and they have to be owned at country level. And so we're going to have to work towards building capacity at country level so that the goals can be implemented. I think it's pretty simple that the promise of universal health care that the goals talk about, that universal education that the goals talk about, universal social protection that the goals talk about, will not be met if persons with disabilities are not included. So I think for me, that's a really important piece going forward and thinking, when we think about planning around the goals, that we will not meet these goals if we don't include that 15% of the population that I mentioned. So I'd say in the last 10 years of the CRPD, there has been some progress. But we still have many challenges to ensure more robust implementation of the CRPD and its actual impact on persons with disabilities. So allow me to share with you this morning 5 building blocks that I think are necessary for transformative change and that I think can be used across all disciplines. The first one is the focus on reducing inequalities. We need to be more engaged in the debates around reducing inequalities. We know that rising inequalities present huge challenges throughout the world. Countries experience rapid economic growth, for example, China and India, and they too are experiencing rising inequality. Apparent economic growth successes in some of the lowest income countries in Africa have been very unevenly distributed, with benefits often accruing to elite and privileged people and places. And we know that people with disabilities are amongst the poorest of the poor. And so as we think about rising inequality, we need to think about that using a disability lens. A good indicator of that is the employment rates of persons with disabilities. Globally, they remain abysmally low. According to the US Disability Labor Force Characteristics Summary of 2014, only 17.1% of persons with disabilities were employed. In contrast, the employment population ratio for those without a disability was 64.6%. So that's clearly an inequality, and it has consequences for rising inequality. We know that economic inequalities intersect with social and political inequalities, whether associated with disability, gender, age, identity, sexual orientation, or ethnicity. And with high unemployment figures, such as the example I just gave, demand on us to do more to untangle the interactions between disability and economic, political, social, and discrimination is absolutely necessary if we want to see transformative change. My second building block that I'd like to share with you is the need to build inclusive societies. I think the Sustainable Development Goals provide an interesting framework to do that. But we need to be more excited about making this happen. We need to accelerate sustainability and build more inclusive societies that reflect our conviction to the principles of the CRPD. One quick accelerated example that comes to my mind is to look at universal design and designing in a manner that is inclusive for all. I think we need to look at ways when we think about inclusive societies, and I was glad to see that this was on the program, to really start to ensure that we are raising awareness and building capacity amongst planners, architects, designers, engineers. They are as important as social development workers, as human rights lawyers, and we really need to make sure that we are working with across disciplines and ensuring that everybody is part of this. In this regard, we also need to talk about the business case for inclusion. We need to highlight the investment gains that come with creating a more inclusive society. We need to emphasize that inclusive societies are a win-win for all. My third building block is on curating and co-constructing knowledge. And here I think we together need to co-construct a new narrative for disability inclusion that is not victim or charity-based, but one that assumes a more positive empowerment, one that talks about opportunity. And I think reshaping that narrative becomes really important for disability inclusion going forward. And this can be done through the co-construction of research and learning, very importantly, with persons with disabilities who have the lived experience and often have the knowledge and solutions. So we need to be more deliberate about engaging disabled people's organizations, working with local researchers, academics, and policy actors to bring their own experience and knowledge to bear on shaping new research and learning agendas. In short, we need to pursue a more democratic approach to the construction and the sharing of research and knowledge to promote social justice. Because you see, often the cutting edge knowledge comes from the practice on the ground. And that's why I'm really excited to see so many practitioners on the program, and I look forward to learning from them and listening to their best practices. My fourth building block is evidence for impact. Now, surely you'll agree with me that impact is not only about producing evidence to inform policy and practice, but also providing new innovative ways of learning and translating policy into practice. Practice that impacts on behavior, that shapes new values, and makes transformation possible. So achieving impact means not just producing evidence, but engaging with the politics of knowledge. Who is producing the knowledge? Who is the knowledge being produced for? Is their voice? Is the voice of persons with disabilities part of that? So to do that, I think we need to be more aggressive about harnessing accessible ICT, for instance, and using the digital innovation to connect evidence to people whose voices are often not heard. And so I think Twitter is a great way of doing that, but there are many, many other ways to do that. We need to deliver high-quality research with more reliable disability disaggregated data and more robust research that draws on multiple forms of knowledge and links multidisciplines and professions and builds on local knowledge in order to develop evidence, insights, and understandings that will help address highly complex challenges around disability inclusion. We need to be a bit more clever about understanding what is the cost of exclusion. And we need to be, in my view, a bit more sophisticated about how we measure success in this space. My fifth block is fostering enduring partnerships. And here I think it's absolutely essential that we need to be fully committed to the belief that through enduring partnerships with others, including, very importantly, persons with disabilities, in our research, in our mutual learning, in our communications, that we can collectively address social inclusion at local, national, and at global level. For we know that the quest for a world without poverty, where social justice is real and sustainable economic growth benefits all, will not happen without dedicated, passionate, and enduring efforts in researching, learning, teaching human rights and development for all. We know that exclusion limits opportunities and that the real trigger to economic growth is, in fact, inclusion. Finally, ladies and gentlemen, the inclusive agenda is a very compelling one. I am optimistic. It's only been 10 years. There is nothing inevitable about exclusion. And I have seen how disability inclusion is happening. We need to collectively rethink diversity and inclusion and double down to get it done. Let me close with my favorite African proverb. If you want to go quickly, go alone. But if you want to go further, go together. Thank you very much for your attention, and I look forward to the day.